Welcome to Health and Wealth. If you're trying to quit smoking cigarettes and are considering vaping as a safer alternative, there are a few things you should know. Vaping can be just as addictive as smoking, making it hard to quit, even when used as a smoking cessation tool. Both vaping and smoking have serious side effects and can be harmful. A seemingly harmless puff on a vape can quickly turn into a habit and eventually an addiction. In this video, I'll dive into the similarities and differences between smoking and vaping, including which age groups are using each. I'll discuss the health risks of both, explain which is more harmful, and offer strategies to help you quit. Finally, I'll advise when to see a doctor about symptoms related to smoking and vaping. Demographics. Vaping has become more popular among all age groups in recent years. Around 6% of U.S. adults vape, but it's especially popular among young people. In 2020, researchers found that more than 3.6 million U.S. youth were regularly vaping. Students as young as middle school are vaping, and increasing numbers of teens and young adults are developing nicotine dependence. Among young people who vape, 85% reported using flavored e-cigarettes such as menthol, mint, candy, and fruit flavors, with most users citing appealing flavors as the main reason for use. It's unsafe for youth to use any form of nicotine, including cigarettes and vaping. Smoking in any form is an epidemic among our youth and a public health crisis. Vaping versus smoking. The fundamental difference between smoking traditional cigarettes and vaping is smoke versus vapor. Smoking delivers nicotine to your lungs by burning tobacco. The smoke is then inhaled. Vaping uses a battery-operated heater to warm an e-liquid or e-juice, creating a vapor that is inhaled. Both methods deliver nicotine to your lungs, leading to addiction and serious health complications. E-liquids contain ingredients, such as ultra-fine particles, that can be harmful to your health. Long-term risks of vaping. Vapes and other e-cigarettes have been linked to serious health problems, including lung deterioration, nicotine addiction, poisoning, and seizures. Long-term vaping increases the risk of stroke, heart attack, and possibly cancer. Some vape flavorings and additives are associated with severe health problems. Diacetyl, a popular flavoring, can lead to lung issues. Vitamin E acetate, used as a thickening agent in THC-containing e-cigarettes, is linked to a dangerous lung disease called e-cigarette or vaping product use-associated lung injury, EVALI. EVALI causes shortness of breath, fever, and rapid heart rate. Long-term risks of smoking. Smoking conventional cigarettes has long-term risks that can be severe and fatal. More than 16 million Americans suffer from smoking-related diseases. Smoking can harm nearly every organ in your body and is the leading cause of preventable death in the U.S. It can cause lung damage and lead to cancer, diabetes, stroke, heart disease, vascular diseases, and lung diseases. Which is more harmful? Neither is safe. Both cigarettes and e-cigarettes contain thousands of chemicals, many of which are toxic and can cause serious health issues. Inhaling from either a cigarette or e-cigarette can damage your lungs and quickly affect the rest of your body. Quitting vaping versus quitting smoking. For many smokers trying to quit, vaping may seem like an attractive option, marketed as safer with fewer chemicals. However, vaping is not a safe substitution. The number of toxins in vape products is significant. Vaping can turn into a habit where you smoke and vape, increasing nicotine consumption and exposure to unknown chemicals. Which is more addictive? Both vaping and smoking can be addictive, depending on various factors like age and socioeconomic status. Vaping can be more addictive among youth due to peer pressure, flavors, frequency of use, and perceived safety. Unregulated nicotine doses in each inhalation mean that nicotine intake varies, and over time, nicotine intake and dependence may increase. Tips for quitting. If you're trying to quit either habit, consider the following. Know what symptoms to expect and choose a time when you can manage them. Have a quit plan. Your healthcare provider can help. Avoid triggers, including certain routines, alcohol, and other smokers. Replace smoking with another activity, like exercise or eating something healthy. Utilize free resources, including support groups. Be patient and reward yourself for staying on track. If you relapse, identify and avoid triggers when you try quitting again. When to see a doctor. If you vape, you're at risk of EVALI. Symptoms of EVALI, similar to the flu, include shortness of breath, dry cough, chest pain, chills, fever, headache, dizziness, vomiting, diarrhea, abdominal pain, coughing up blood, and unusual weight loss. Smokers should see a doctor if they have a persistent cough, blood-tinged phlegm, shortness of breath, wheezing, chest pain, or a sore throat. Your doctor can conduct a physical examination and provide treatment or medications to help you quit smoking. That's all I have for you today. Thank you for watching Health and Wealth. As a reminder, don't forget to like and subscribe for more content.